Practice Questions CNA State Exam Flashcards, 2026. Question 1. When assisting a client in learning how to use a cane, the nurse aide stands A. approximately 2 feet directly behind the client, B. about 1 foot from the client's weak side, C. about 1 foot from the client's strong side, D. is slightly behind the client on the client's weak side. The correct answer is slightly behind the client on the client's weak side. Standing slightly behind the client on the weak side allows the aide to support the client if they lose balance. Question 2. When working with a client who has urinary retention, the nurse aide can expect that the client will A. urinate large volumes, B. be unable to urinate, C. urinate frequently, D. be incontinent of urine. The correct answer is be unable to urinate. Urinary retention is the inability to empty the bladder completely or at all. Question 3. Aging-related hearing changes result in older clients gradually losing their ability to hear A. high-pitched sounds, B. low-pitched sounds, C. slow sounds, D. rapid sounds. The correct answer is high-pitched sounds. Presbycusis, or age-related hearing loss, typically involves the loss of high-pitched sounds first. Question 4. The best way to safely identify your patient is by A. asking his name, B. calling his name and waiting for his response, C. checking the bed plate, D. checking the name tag. The correct answer is checking the name tag. Checking the identification band, name tag, is the most reliable method to prevent errors. Question 5. A client is on a bowel and bladder training program and has not had a bowel movement in 3 days. The nurse aide should A. report it to the charge nurse, B. give the client an enema, C. offer the client prune juice, D. encourage the client to drink more fluids. The correct answer is report it to the charge nurse. The nurse aide must report changes in bowel habits to the nurse, who determines the appropriate intervention. Question 6. The proper medical abbreviation for before meals is A. PCB, BIDC, ACD, TID. The correct answer is AC. AC stands for anti-cybum, which means before meals. Question 7. A client diagnosed with hypertension will most likely have a history of A. low blood pressure, B. high blood pressure, C. low blood sugar, D. high blood sugar. The correct answer is high blood pressure. Hypertension is the medical term for high blood pressure. Question 8. A patient who has difficulty chewing or swallowing will need what type of diet? A. Clear liquid, B. Low residue, C. Bland, D. Mechanical soft. The correct answer is mechanical soft. Mechanical soft diets are modified in texture to require less chewing. Question 9. An elderly resident with Alzheimer's disease cannot find her room. How can the nurse aide help the client feel more independent? A. Tell her to stay in the room. B. Have her roommates secretly watch her. C. Place a familiar object on the client's door. D. Write the room number on a piece of paper. The correct answer is place a familiar object on the client's door. Visual cues like familiar objects help residents with dementia recognize their surroundings. Question 10. How often should a patient's intake and output records be totaled? A. Once each shift, B. Twice a day, C. Every 4 hours, D. Every 12 hours. The correct answer is once each shift. Intake and output are typically totaled at the end of every shift to monitor fluid balance. Question 11. Which of the following should the nursing assistant observe and record when admitting a client? A. Freckles. B. Wrinkles. C. Short nails. D. Bruises. The correct answer is bruises. Bruises must be documented upon admission to establish a baseline and rule out abuse or prior injury. Question 12. When responding to a client on the intercom, the nursing assistant should say, A. Hello, who is calling, please? B. What is it that you want? C. This is, nursing assistant name and position, can I help you? D. Please hold, I'll have the nurse answer your call. The correct answer is this is, nursing assistant name and position, can I help you? Professional etiquette requires identifying oneself and offering assistance politely. Question 13. Which of the following things should the nurse aide do to familiarize new clients with their surroundings? A. Demonstrate the location and use of the call light. B. Explain that the TV is not to be used. C. Instruct family to leave the room after the aide is finished with the admission. D. Raise the bed to the high position and raise the safety rails. The correct answer is demonstrate the location and use of the call light. Ensuring the client knows how to use the call light is a critical safety measure. Question 14. When arranging a client's room, the nursing assistant should do all of the following except A. Checking the placement of the call bell. B. Adjusting the backrest as directed. C. Administering the client's medications. D. Adjusting the lighting as appropriate. The correct answer is administering the client's medications. Administering medications is outside the scope of practice for a nursing assistant. Question 15. When assisting a client out of bed, the nurse aide should always A. Employ body mechanic techniques. B. Get another nurse aide to assist. C. Raise the bed to its maximum height. D. Lower all safety rails. The correct answer is employ body mechanic techniques. Using proper body mechanics prevents injury to both the aide and the client. Question 16. How often should clients be repositioned during an 8-hour shift? A. Q1HB, Q2HC, Q3HD, Q4H. The correct answer is Q2H. Standard practice is to reposition immobile clients every 2 hours, Q2H, to prevent pressure ulcers. Question 17. Which of the following is the correct procedure for serving a meal to a client who must be fed? A. Serve the tray along with all the other trays, and then come back to feed the client. B. Bring the tray to the client last, feed after you have served all the other clients. C. Bring the tray into the room when you are ready to feed the client. D. Have the kitchen hold the tray for 1 hour. The correct answer is bring the tray into the room when you are ready to feed the client. Food should be served at the proper temperature. Bring the tray only when ready to feed. Question 18. The most serious problem that wrinkles in the bedclothes can cause is A. Restlessness. B. Sleeplessness. C. Decubitus ulcers. D. Bleeding in shock. The correct answer is decubitus ulcers. Wrinkles cause friction and pressure, leading to skin breakdown, decubitus ulcers. Question 19. Restorative care begins A. As soon as possible. B. When the client is ready. C. When the client is discharged. D. When the client is diagnosed as terminally ill. The correct answer is as soon as possible. Restorative care starts immediately to maintain the highest possible level of function. Question 20. Before placing a client in Fowler's position, the nurse aide should A. Open the window. B. Explain the procedure to the client. C. Check with the client's family. D. Remake the bed. The correct answer is explain the procedure to the client. Always explain procedures to the client first to reduce anxiety and gain cooperation. Question 21. During hand washing, the nurse aide accidentally touches the inside of the sink while rinsing the soap off. The next action is to A. Allow the water to run over the hands for 2 minutes. B. Dry the hands and turn off the faucet with the paper towel. C. Repeat the wash from the beginning. D. Repeat washing, but for half the time. The correct answer is repeat the wash from the beginning. Touching the sink contaminates the hands, requiring the process to start over. Question 22. How should a nurse aide dress for a job interview? A. Wearing a clean t-shirt and casual slacks. B. Wearing a nurse aide uniform. C. Wearing a business suit, dress, or pants and dress shirt. D. Wearing formal attire. The correct answer is wearing a business suit, dress, or pants and dress shirt. Professional business attire creates the best impression for an interview. Question 23. An ambulatory client is newly admitted. Before leaving the client alone, the nurse aide should A. Ask if the client is hungry. B. Inspect the client's skin. C. Assess the client's intake and output. D. Make sure the client knows how to use the call bell. The correct answer is make sure the client knows how to use the call bell. Safety is the priority. The client must know how to call for help. Question 24. When lifting a heavy object, the correct method would be to bend at the A. Waist, keeping your legs straight. B. Waist, rounding your shoulders. C. Knees, keeping your back straight. D. Knees and waist. The correct answer is knees, keeping your back straight. Lifting with the legs, knees bent, back straight, protects the back from injury. Question 25. When should nurse aides wash their hands? A. After eating. B. Before using the bathroom. C. After client care. D. Before cleaning a bedpan. The correct answer is after client care. Hand hygiene must be performed after client care to prevent cross-contamination. Question 26. When assisting a client with eating, one of the first things the nurse aide should do is A. Cut the food into bite-sized pieces. B. Wash his own hands and the client's hands. C. Butter the client's bread. D. Provide the client with privacy. The correct answer is wash his own hands and the client's hands. Hygiene comes first to prevent ingesting pathogens. Question 27. A patient has a new cast on her right arm. While caring for her, it is important to first observe 4. A. Pulse above the cast. B. Color and hardness of the cast. C. Warmth and color of fingers. D. Signs of crumbling at the cast end. The correct answer is warmth and color of fingers. Warmth and color indicate proper circulation. Cold/blue fingers suggest the cast is too tight. Question 28. Encouraging a client to take part in activities of daily living, ADLs, such as bathing, combing hair, and feeding is A. Done only when time permits. B. The family's responsibility. C. Necessary for rehabilitation. D. A violation of client rights. The correct answer is necessary for rehabilitation. Participation in ADLs promotes independence and rehabilitation. Question 29. In caring for a confused elderly man, it is important to remember to A. Keep the bedrails up except when you are at the bedside. B. Close the door to the room so that he does not disturb other patients. C. Keep the room dark and quiet at all times to keep the patient from becoming upset. D. Remind him each morning to shower and shave independently. The correct answer is keep the bedrails up except when you are at the bedside. Bedrails, if ordered, help prevent falls, but safety is the priority when not at the bedside. Question 30. Before assisting a client into a wheelchair, the first action would be to check if the A. client is adequately covered. B. floor is slippery. C. door to the room is closed. D. wheels of the chair are locked. The correct answer is wheels of the chair are locked. Locking the wheels prevents the chair from rolling away during transfer. Question 31. A client has a weak left side. When transferring the client from the bed to the wheelchair, the nurse aide should stand A. on the right side, B. in front of the client, C. on the left side, D. behind the client. The correct answer is on the left side. Support the weak side to prevent falls during transfer. Question 32. While making rounds at 5:30 a.m., a nurse aide finds a patient lying on the floor. What should the nurse aide do first? A. Call 911. B. Perform CPR. C. Call for help. D. Assess the client's pulse and respirations. The correct answer is assess the client's pulse and respirations. Assess the patient first to determine the nature of the emergency before acting. Question 33. When moving a wheelchair onto an elevator, the nurse aide should stay A. behind the chair and pull it toward the aide. B. behind the chair and push it away from the aide. C. in front of the client to observe the client's condition. D. at the side of the wheelchair while opening the door. The correct answer is behind the chair and pull it toward the aide. Backing into the elevator prevents the client from staring at the wall and allows easier exit. Question 34. The Foley bag must be kept lower than the client's bladder so that A. urine will not leak out, soiling the bed. B. urine will not return to the bladder, causing infection. C. the bag will be hidden and the client will not be embarrassed. D. the client will be more comfortable in bed. The correct answer is urine will not return to the bladder, causing infection. Preventing backflow of urine reduces the risk of urinary tract infections, UTIs. Question 35. As an afternoon snack, the kitchen sent a diabetic client a container of chocolate ice cream. The nursing assistant should first A. substitute diet soda for the ice cream. B. hold the afternoon snack and report to the charge nurse. C. call the kitchen and report the error. D. allow the client to have half of the ice cream. The correct answer is hold the afternoon snack and report to the charge nurse. Do not give the food if it violates the diet order. Report to the nurse for instruction. Question 36. When assisting a client who is using the commode, it is important to A. leave the call light within reach. B. lock the door to promote privacy. C. stand next to the client until the client is finished. D. restrain the client to prevent a fall. The correct answer is leave the call light within reach. Safety requires the client to have a way to call for help immediately. Question 37. Ensuring adequate circulation to tissues is a major factor in preventing skin breakdown. This can be accomplished by doing all of the following except A. positioning the patient every 4 hours. B. using mechanical aids. C. giving back rubs. D. performing active or passive ROM exercises. The correct answer is positioning the patient every 4 hours. Positioning must be done every 2 hours, not 4, to prevent breakdown. Question 38. The purpose of cold applications is usually to A. speed the flow of blood to the area. B. prevent heat exhaustion. C. prevent or reduce swelling. D. prevent the formation of scar tissue. The correct answer is prevent or reduce swelling. Cold constricts blood vessels, reducing swelling and inflammation. Question 39. The hot water bottle is an example of A. local dry heat application. B. a generalized dry heat application. C. Local moist heat application. D. Generalized moist heat application. The correct answer is local dry heat application. A hot water bottle applies dry heat to a specific area. Question 40. Clients receiving an enema are usually placed A. on the right side, B. on the left side, C. flat on the back, D. in a semi-sitting position. The correct answer is on the left side. Sim's position, left side, follows the natural curve of the sigmoid colon. Question 41. A female client's perineal area should be cleansed before which specimen is collected? A 24-hour urine specimen, B. Midstream clean catch urine specimen, C. Pediatric routine urine specimen, D. Routine urine specimens. The correct answer is midstream clean catch urine specimen. Clean catch requires cleansing to prevent contamination of the sample. Question 42. The most common site for counting the pulse is the A. carotid artery, B. femoral artery, C. brachial artery, D. radial artery. The correct answer is radial artery. The radial artery, wrist, is the most convenient and common site. Question 43. When counting respirations, the nurse aide should A. wait until after the client has exercised, B. not tell the patient what he is going to do, C. count 5 respirations and then check his watch, D. have the client count respirations while the aide takes her pulse. The correct answer is not tell the patient what he is going to do. If the patient knows you are counting, they may alter their breathing pattern. Question 44. Which of the following is not the nurse aide's responsibility when caring for clients who have urinary catheters? A. Inserting the catheter, B. Ensuring that the catheter drains properly, C. Preventing infection, D. Recording urinary output. The correct answer is inserting the catheter. Inserting a sterile catheter is a skilled procedure usually performed by a nurse. Question 45. When giving information to the charge nurse for an incident report, the nurse aide should A. write in the client's chart that an incident occurred, B. keep the report in her personal file, C. state the facts clearly, D. give her opinions as to the cause of the incident. The correct answer is state the facts clearly. Incident reports must be factual and objective, without opinion. Question 46. All long-term care nurse aides must be competency evaluated and must complete a distinct educational course. These requirements are set by A. WOBRA, B. OSHA, C. CDC, D. FDA. The correct answer is OBRA. The Omnibus Budget Reconciliation Act, OBRA, sets training standards for CNAs. Question 47. A resident is blind. It is important not to A. leave the door completely opened, B. rearrange the furniture, C. announce yourself before entering the room, D. explain the location of food on the plate, using the face of the clock to assist. The correct answer is rearrange the furniture. Rearranging furniture creates a safety hazard for visually impaired residents. Question 48. When family members visit a client, the visitors should A. stay in the day room, B. stay a short while so as not to tire the client, C. be expected to help with care, D. be allowed privacy with the client. The correct answer is be allowed privacy with the client. Residents have a right to private visits. Question 49. A resident asks, if I need help during the night, who will be there? The nursing assistant should respond, A, don't worry, you'll be okay. B, just yell, someone will hear you. C, your roommate will probably ring the call bell. D, there are people here all night to help you. The correct answer is there are people here all night to help you. Reassurance of 24-hour staffing helps alleviate anxiety. Question 50. Which of the following is a client's right? A. Having personal information kept confidential. B. Obtaining private duty staff if desired. C. Knowing what is wrong with the client's roommate. D. Treating the staff any way he or she pleases. The correct answer is having personal information kept confidential. Confidentiality is a fundamental resident right, HIPAA. Question 51. A resident often cries while she is receiving her PM care. What should the nurse aide do? A. Tell her to stop crying. B. Ignore her and continue with her care. C. Tell her jokes to make her laugh. D. Tell her that it's all right to cry, and that the aide is there for her if she wants to talk. The correct answer is tell her that it's all right to cry, and that the aide is there for her if she wants to talk. Offering emotional support and a listening ear is part of the aide's role. Question 52. When providing denture care, the nurse aide must A. Wash them in boiling water. B. Hold them under warm running water. C. Dunk them in and out of cool water. D. Place them on a towel in the sink with cool water. The correct answer is place them on a towel in the sink with cool water. A towel prevents breakage if dropped, cool water prevents warping. Question 53. Sexuality in long-term care clients may include all of the following except A. Needing private time with a partner. B. Caring about one's physical appearance. C. Engaging in public fondling. D. Desiring sexual interaction. The correct answer is engaging in public fondling. Public sexual behavior is generally inappropriate. Privacy should be provided. Question 54. A client is scheduled for a partial bed bath. This means that the nurse aide must wash the client's A. Face, neck, ears, arms, and hands. B. Face, axilla, hands, and buttocks. C. Face, hands, axilla, and legs. D. Face, hands, axilla, genitals, and buttocks. The correct answer is face, hands, axilla, genitals, and buttocks. A partial bath cleans the areas that would cause odor or discomfort if left unwashed. Question 55. An agitated resident must be turned every 2 hours all night long. The first action of the nurse aide when waking up this resident is to A. Turn on the light. B. Speak quietly and calmly. C. Touch her shoulder. D. Shout her name. The correct answer is speak quietly and calmly. Speaking calmly helps prevent startling and further agitating the resident. Question 56. If a client objects to certain food for religious or cultural reasons, the appropriate action would be to A. Tell him to wait for the next meal. B. Offer to substitute something different for him. C. Call the dietitian the next day. D. Tell him he needs to eat what is on his tray. The correct answer is offer to substitute something different for him. Respecting dietary restrictions is part of culturally competent care. Question 57. The client's religion forbids eating pork. Bacon is being served for breakfast. The most appropriate response is to A. Encourage the client to eat it because she needs protein. B. Tell the client it is all right since her doctor ordered the diet. C. Call the kitchen for a tray without bacon. D. Tell the client that restrictions are not as important as her health. The correct answer is call the kitchen for a tray without bacon. The aide should ensure the meal complies with the resident's religious restrictions. Question 58. Which type of communication can often be most powerful? A. Written. B. Verbal. C. Silent. D. Tactile. The correct answer is silent. Nonverbal communication, silence, body language, often conveys more than words. Question 59. A client refuses to allow the nurse aide to bathe her. The nurse aide tells the client that she will not be allowed to eat lunch or go to bingo if she does not have her bath. This is an example of A. Rehabilitation, B. Discipline, C. A verbal abuse, D. Physical abuse. The correct answer is verbal abuse. Threatening the resident is a form of verbal/psychological abuse. Question 60. On entering a room, an aide notices that the client is not breathing. The aide's first action should be to A. Call for help, B. Lay the client down on his back, C. Give 4 quick breaths, D. Give 8 to 10 abdominal thrusts. The correct answer is call for help. Immediately calling for help activates the emergency response system. Question 61. A client's dentures are lost. The first action should be to A. Notify the administrator, B. Look for them, C. Notify the doctor, D. Notify the charge nurse. The correct answer is notify the charge nurse. Reporting the loss protects the aide and initiates the facility's protocol for lost items. Question 62. Nursing assistants are responsible for A. Planning client care, B. Doing tasks assigned by the charge nurse, C. Performing without ever asking for help, D. Comparing assignments with co-workers. The correct answer is doing tasks assigned by the charge nurse. CNAs work under the supervision and assignment of the nurse. Question 63. A patient turns on the call light when he needs to urinate. The appropriate action is to A. Ignore the light, since he is not the aide's own client, B. Announce on the intercom that there are 2 patients ahead of him, C. Answer the call light and get the urinal, D. Answer the call light when the aide has the time. The correct answer is answer the call light and get the urinal. Call lights should be answered by any available staff member promptly. Question 64. A client is on CMR and in the prone position. The nurse aide finds the client vomiting bright red blood. The nurse aide should first A. Clean up the vomit, B. Place the client in the side-lying position, C. Provide the client with an emesis basin, D. Call the charge nurse. The correct answer is place the client in the side-lying position. Positioning on the side prevents aspiration of the vomit/blood. Question 65. When performing catheter care, the nurse aide should wash the catheter A. toward the meatus, B. with betadine soap, C. away from the meatus, D. with alcohol. The correct answer is away from the meatus. Washing away from the meatus prevents introducing bacteria into the urethra. Question 66. A nurse aide who applies restraints on a client without directions from the charge nurse may be accused of A. slander, B. battery, C. false imprisonment, D. negligence. The correct answer is false imprisonment. Unlawful restraint of a person is considered false imprisonment. Question 67. HS care is care that is given A. before meals, B. before bedtime, C. after meals, D. upon awakening. The correct answer is before bedtime. HS stands for insomnia, meaning hour of sleep or bedtime. Question 68. The best food choices for a geriatric client with no teeth would include A. hamburger, French fries, corn, and ice cream, B. Baked chicken, dressing, green beans, and coconut macaroons. C. Spare ribs, macaroni and cheese, coleslaw, and fruit cocktail. D. Baked fish, whipped potatoes, spinach souffle, and tapioca. The correct answer is baked fish, whipped potatoes, spinach souffle, and tapioca. These foods are soft and easy to swallow, mechanical soft/puree friendly. Question 69. A client's family wants to talk about the client's impending death, but the client does not want to talk about it. The family should be encouraged to A. Carry on the conversation away from the client. B. Talk freely in front of the client in order to help the client to accept it. C. Wait until the client dies to talk about it. D. Force the client to talk about it with them. The correct answer is carry on the conversation away from the client. Respect the client's wishes, discuss sensitive topics outside the room. Question 70. A nurse aide notices that a water pitcher has spilled onto the floor. The best action for the aide to perform is to A. Wipe it up immediately. B. Cover it with a towel. C. Notify the charge nurse. D. Contact housekeeping. The correct answer is wipe it up immediately. Immediate cleanup prevents slips and falls. Question 71. When should post-mortem care be performed? A. After the family views the body. B. Immediately after doctor pronounces. C. When rigor mortis sets in. D. After body goes to the morgue. The correct answer is immediately after doctor pronounces. Post-mortem care is done immediately after pronouncement to prepare for family viewing. Question 72. The purpose of correctly positioning the client is to A. Prevent skin breakdown. B. Maintain function of joints and muscles. C. Increase comfort. D. All of the above. The correct answer is all of the above. Proper positioning serves multiple purposes including safety, comfort, and health maintenance. Question 73. A surgical bed should be left in what position? A. Lowest position. B. Highest position. C. Fowler's position. D. A Trendelenburg position. The correct answer is highest position. A surgical bed is left in the highest position to match the stretcher height for transfer. Question 74. A female resident's husband has asked for some time alone with his wife in her room. What should the nurse aide do? A. Let the husband visit but listen outside the door. B. Let the husband visit and leave the door open. C. Tell the husband not to disturb his wife. D. Let the husband visit in private. The correct answer is let the husband visit in private. Married couples have the right to privacy. Question 75. A resident needs range of motion (ROM) exercises every day. When the nurse aide tries to help her do the exercises, the resident says she will not do them because they are too hard. Best response? A. Try harder and the exercises will be easier. B. I understand, but try working slowly and resting often. C. The doctor ordered the exercises because they are important. D. Think of something good during the exercises and maybe they won't be so hard. The correct answer is I understand, but try working slowly and resting often. Acknowledging feelings and offering a compromise/modification encourages cooperation. Question 76. A nurse aide enters a room to check on a resident who is in restraints. The nurse aide finds that the resident has gotten out of the restraint and is partly out of the bed. What should the nurse aide do? A. Call for help to get the resident back into bed and put the restraint back on. B. Put the restraint back on tightly so that the resident cannot move. C. Leave the restraint off and report the problem to the charge nurse. D. Put a different type of restraint on the resident. The correct answer is call for help to get the resident back into bed and put the restraint back on. Ensure safety first by getting help and resecuring the safety device properly. Question 77. A resident does not want to wear her dentures. She says she has a sore in her mouth. The nurse aide should A. Tell her to leave her dentures out for a few days. B. Have the resident rinse her mouth with salt water. C. Tell her that she will feel better if she wears the dentures. D. Leave the dentures out and ask the nurse to check the resident's mouth. The correct answer is leave the dentures out and ask the nurse to check the resident's mouth. Pain indicates a potential problem that requires a nurse's assessment. Question 78. After a resident has died, the nurse aide is often assigned to do which of the following? A. Prepare the resident's body. B. Call the resident's family. C. Call the resident's doctor. D. Call the undertaker. The correct answer is prepare the resident's body. Postmortem care, preparing the body, is within the CNA scope of practice. Question 79. A resident complains that he cannot fall asleep. What can the nurse aide do first to help him relax? A. Move him to the day room. B. Give the resident a back rub. C. Give the resident a sleeping pill. D. Report the resident's complaint to the charge nurse. The correct answer is give the resident a back rub. A back rub is a non-invasive nursing comfort measure to promote sleep. Question 80. A resident is to start range of motion (ROM) exercises. When performing ROM exercises on a resident, what does the nurse aide do to each joint? A. Stretch it until it hurts. B. Rotate it in both directions until it hurts. C. Bend it to a 90-degree angle while supporting the limb. D. Move it to its fullest range or until the resident feels discomfort. The correct answer is move it to its fullest range or until the resident feels discomfort. ROM should never cause pain, move only to resistance or discomfort. Question 81. A sign on the resident's door says NPO. What does this sign tell the nurse aide about the resident? A. The resident is receiving AM care. B. The resident is receiving oxygen therapy. C. The resident is not to be given any solid food. D. The resident is not to be given anything by mouth. The correct answer is the resident is not to be given anything by mouth. NPO means nothing by mouth, nil per os. Question 82. A resident is smoking a cigarette in the smoking area. The resident keeps dropping the cigarette in his lap. What should the nurse aide do first? A. Stay with the resident until he is finished smoking. B. Tell the resident that he must be more careful. C. Check on the resident every few minutes. D. Go and report it to the charge nurse. The correct answer is stay with the resident until he is finished smoking. Safety is the priority. Stay to prevent a fire or burn injury. Question 83. A nurse aide is assigned to care for a resident who asks her to stay with her because she thinks she is dying. What should the nurse aide do? A. Scold the resident for talking that way. B. Ask the resident why she feels this way. C. Tell the resident that isn't true. D. Ignore the resident's behavior. The correct answer is ask the resident why she feels this way. Open-ended questions provide support and validate the resident's feelings. Question 84. A resident is able to dress himself, but he is very slow. What should the nurse aide do to assist this resident to get to breakfast on time? A. Address the resident. B. Tell the resident to hurry. C. Start the resident dressing earlier. D. Warn the resident he is going to miss breakfast. The correct answer is start the resident dressing earlier. Adjusting the schedule supports independence without causing stress. Question 85. A nurse aide is caring for a resident on bed rest. The resident is not able to turn herself. What is the longest time that the nurse aide is allowed to leave the resident in one position? A. 1 hour. B. 2 hours. C. 3 hours. D. 4 hours. The correct answer is 2 hours. Standard of care for immobility is turning at least every 2 hours. Question 86. A resident's care plan calls for the resident to ambulate 50 feet twice a day. The resident tells the nurse aide that she is unable to do it now. What should the nurse aide do? A. Ask the resident to be more helpful. B. Ask the charge nurse to change the care plan. C. Tell the resident that she can skip her walk today. D. Allow the resident to choose a better time to ambulate. The correct answer is allow the resident to choose a better time to ambulate. Offering choice promotes cooperation and autonomy. Question 87. A nurse aide notices that a resident has very dry skin on the feet. How should the nurse aide care for the resident's feet? A. Erase them on a pillow. B. Wash and dry them only. C. Keep socks on them at all times. D. Apply lotion after washing and drying the feet. The correct answer is apply lotion after washing and drying the feet. Lotion hydrates the skin and prevents cracking. Question 88. An elderly resident is normally alert, but today she is slightly confused. What should the nurse aide do? A. Say, it is not like you to act like this. B. Report the confusion to the charge nurse. C. Not worry because all old people get confused sometimes. D. Ignore the confusion because the resident may only be trying to get extra attention. The correct answer is report the confusion to the charge nurse. Sudden confusion, delirium, can indicate infection, like UTI, and must be reported. Question 89. A nurse aide has found a fire in a resident's waste can. What should the nurse aide do first? A. Pull the fire alarm. B. Pour water on the fire. C. Move residents out of immediate danger. D. Use the fire extinguisher to put out the fire. The correct answer is move residents out of immediate danger. Rescue/remove residents is always the first step. Question 90. What is the first thing a nurse aide should do after receiving the resident assignments for the shift? A. Start giving care to the first resident on the assignment. B. Make rounds and see each resident briefly. C. Task another nurse aide what to do first. D. Find out when the lunch break is. The correct answer is make rounds and see each resident briefly. Making rounds ensures safety and helps prioritize care for the shift. Question 91. A nurse aide is walking with a resident. The resident says that she is going to faint. What should the nurse aide do? A. Open a window to give the resident air. B. Walk the resident to her room quickly. C. Assist the resident to sit slowly on the floor. D. Hold the resident on her feet until she feels better. The correct answer is assist the resident to sit slowly on the floor. Safely lowering the resident prevents injury from a fall. Question 92. A resident is upset after a family visit. The resident tells the nurse aide not to allow the family to visit again. Which of the following is the nurse aide's best response? A. Okay, I will tell them not to visit. B. I will inform the receptionist immediately. C. Can you tell me why you are so upset? D. You will feel differently about it tomorrow. The correct answer is can you tell me why you are so upset? Exploring the feelings helps the aide understand the situation better. Question 93. A nurse aide is feeding a resident a pureed diet. How should the nurse aide feed the resident? A. By feeding all of one food at a time. B. By giving portions from each food on the tray. C. By mixing the food together to make feeding easier. D. Any way the nurse aide wishes because pureed food has no taste. The correct answer is by giving portions from each food on the tray. Alternating foods makes the meal more palatable and normal. Question 94. A resident is on oxygen. He tells the nurse aide that he is not getting enough oxygen through the tubing. What should the nurse aide do first? A. Turn up the oxygen. B. Turn off the oxygen. C. Check the tubing. D. Tell the patient to breathe faster to get more oxygen. The correct answer is check the tubing. Checking for kinks or disconnections is the first troubleshooting step. Question 95. Which of the following is a true statement about the elderly? A. They have no sex drive. B. They prefer to be alone. C. They often have problems with vision. D. They are not concerned about privacy. The correct answer is they often have problems with vision. Sensory changes, including vision loss, are common in aging. Question 96. A resident refuses to have a bath and to shave every day. He has not bathed for a week. What should the nurse aide do? A. Force the resident to take a bath and shave every day. B. Ask the charge nurse for assistance with the problem. C. Leave the resident alone as he will want a bath someday. D. Tell the resident's family that the resident has not bathed in a week. The correct answer is ask the charge nurse for assistance with the problem. The nurse needs to intervene to balance hygiene needs with resident rights. Question 97. A resident usually dresses himself for breakfast. Today the nurse aide finds him in pajamas at 10 a.m. What should the nurse aide do? A. Nothing. B. Address the resident. C. Ask him, is there anything wrong today? D. Tell him, I don't have time to dress you. The correct answer is ask him, is there anything wrong today? A change in routine or ability requires investigation/inquiry. Question 98. A nurse aide finds a male resident in bed with a female resident who is confused. What should the nurse aide do? A. Scold the male resident. B. Report this to the charge nurse. C. Close the door and the privacy curtains. D. Put a do not disturb sign on the door. The correct answer is report this to the charge nurse. A confused resident cannot consent. This must be reported immediately. Question 99. A resident with poor vision was admitted to the unit. What should the nurse aide do to ensure the resident's safety? A. Arrange the furniture against the walls. B. Tell the resident to walk around the room by herself. C. Remove all furniture, except the bed and chair, from the room. D. Help the resident become familiar with the location of the furniture in the room. The correct answer is help the resident become familiar with the location of the furniture in the room. Orientation to the environment prevents falls. Question 100. A nurse aide finds clean linen lying on the floor near the linen cart. What should the nurse aide do? A. Discard the linen in the soiled linen hamper. B. Place the linen on the clean linen cart and cover the cart. C. Place the linen in a resident's room for immediate use. D. Leave the linen on the floor for housekeeping staff to remove. The correct answer is discard the linen in the soiled linen hamper. Linen on the floor is considered contaminated. Question 101. A resident cannot walk by herself. What must the nurse aide do before leaving her room? A. Give her a bedpan. B. Tell her to shout if she needs help. C. Put the call light where she can reach it. D. Let another nurse aide know that she is in her room. The correct answer is put the call light where she can reach it. The call light is the lifeline for help. Question 102. A resident has trouble finding her room. What could the nurse aide do to help this resident? A. Speak sharply to her whenever she goes to the wrong room. B. Assign another resident to watch her. C. Make a special sign for her door. D. Keep her in her room. The correct answer is make a special sign for her door. Visual cues aid in orientation. Question 103. A resident dies during the night. At breakfast, another resident who was his friend begins to talk to the nurse aide about the death. What should the nurse aide do? A. Distract the resident by talking about the news of the day. B. Tell the resident to find someone else to talk to. C. Find out who told the resident about the death. D. Allow the resident to talk about the death. The correct answer is allow the resident to talk about the death. Listening provides therapeutic support for grief. Question 104. A resident is lying on the floor having a seizure when the nurse aide walks into the room. What should the nurse aide do first? A. Restrain the resident's arms. B. Put a screen around the resident for privacy. C. Place a padded tongue blade between her teeth. D. Move any objects which could injure the resident and support her head. The correct answer is move any objects which could injure the resident and support her head. Protecting the resident from injury is the priority during a seizure. Question 105. A resident was given a stuffed animal as a gift. The resident wants to keep the stuffed animal with her much of the time. What should the nurse aide do? A. Explain that adults do not hold stuffed animals. B. Task her relatives to take the stuffed animal home. C. Let her hold the stuffed animal whenever she wants to. D. Suggest that she keep the stuffed animal on the windowsill. The correct answer is let her hold the stuffed animal whenever she wants to. This provides comfort and hurts no one. Allow it. Question 106. A resident is dehydrated. The nurse aide's assignment says force fluids. What should the nurse aide do? A. Decrease the resident's fluid intake. B. Increase the resident's fluid intake. C. Give liquids with meals only. D. Measure output. The correct answer is increase the resident's fluid intake. Force fluids means to encourage the resident to drink more often. Question 107. A nurse aide wants to get a resident involved in her own care. Which of these statements would best encourage the resident's involvement? A. Stop feeling sorry for yourself. B. It's time for us to eat our breakfast. C. I want to brush your hair right now. D. Do you want to take your bath now or after breakfast? The correct answer is do you want to take your bath now or after breakfast? Offering choices gives the resident control and involvement. Question 108. A resident has an indwelling catheter. As the nurse aide cares for him, which of these should the nurse aide report to the charge nurse immediately? A. The resident complains of pain and burning. B. The urine in the collection bag is clear and light yellow in color. C. The resident tells the nurse aide that he hates to have a catheter. D. The urine in the collection bag is hanging below the level of the bladder. The correct answer is the resident complains of pain and burning. Pain and burning are signs of infection or trauma. Question 109. What is the best source of information about the care a nurse aide needs to give a resident? A. The resident's family. B. The resident's roommate. C. The resident's plan of care. D. Other nurse aides on the unit. The correct answer is the resident's plan of care. The care plan is the official instruction for care. Question 110. A resident tells the nurse aide that her hearing aid is not working. What should the nurse aide do first? A. Turn up the volume. B. Change the battery. C. Tell the charge nurse. D. Check to see that the hearing aid is turned on. The correct answer is check to see that the hearing aid is turned on. Check the simplest solution first. Is it on? Question 111. While making rounds at 3 a.m., a nurse aide hears a resident crying softly. How should the nurse aide respond? A. Tell the resident that everything will be better in the morning. B. Tell the resident that everything is fine and to cheer up. C. Pretend not to notice that the resident is crying. D. Ask the resident what is wrong. The correct answer is ask the resident what is wrong. Acknowledge the distress and investigate the cause. Question 112. A resident is being discharged from the nursing home. He tells the nurse aide that he feels worried about the change. What is the nurse aide's most helpful response? A. Encourage the resident to talk about his feelings. B. Tell the resident not to worry as things will work out fine. C. Tell the resident that he should be happy to leave the nursing home. D. Suggest to the resident that his worries will go away if he ignores them. The correct answer is encourage the resident to talk about his feelings. Listening and validating feelings is therapeutic. Question 113. A nurse aide is called away from a resident's bedside. When the nurse aide returns, the resident screams, "I'm too old and too sick to be left alone." How should the nurse aide respond? A. You're fine. Don't carry on so. B. I understand, but I have other things to do. C. Why don't you just forget it and rest a while? D. I'm sorry I had to leave. Can I help you now? The correct answer is I'm sorry I had to leave. Can I help you now? Apologizing and refocusing on their needs shows respect and de-escalates. Question 114. A nurse aide is cleaning a resident's closet. He finds moldy food and throws it away. The resident shouts, "Leave my food alone." What is the best response by the nurse aide? A. Why are you saving this food? Do you get hungry between meals? B. You should eat all your meals, so that you are not hungry later on. C. Hiding food is against health laws. D. This moldy food smells awful. The correct answer is why are you saving this food? Do you get hungry between meals? Investigating the underlying reason, hunger/insecurity, helps solve the problem. Question 115. A nurse aide observes that a new resident is upset and frightened while getting ready for bed. The resident tells the nurse aide that a dark room frightens her. What is the nurse aide's best response? A. Darkness can't hurt you. B. As old as you are, you should not be afraid. C. You will soon get used to sleeping in the dark. D. I will leave the door open so the light can come in. The correct answer is I will leave the door open so the light can come in. Accommodate the fear to provide comfort and safety. Question 116. A nurse aide is assisting a resident with lunch. The resident grabs his throat and cannot speak. What should the nurse aide do first? A. Offer the resident a drink. B. Perform the Heimlich maneuver. C. Place the resident on the floor and elevate his feet. D. Keep the resident warm by putting a blanket on him. The correct answer is perform the Heimlich maneuver. The universal sign for choking requires immediate abdominal thrusts, Heimlich. Question 117. A nurse aide realizes from the assignment sheet that a resident has not had a bowel movement for more than 3 days. What should the nurse aide do? A. Ignore the problem. B. Give the resident an enema. C. Report the finding to the charge nurse. D. Sit the resident on the toilet until he has a bowel movement. The correct answer is report the finding to the charge nurse. Constipation must be reported for nurse assessment. Question 118. A resident has had a stroke and has weakness on her right side. Where should the nurse aide stand when helping the resident walk? A. On the resident's right side. B. On the resident's left side. C. In front of the resident. D. Behind the resident. The correct answer is on the resident's right side. Stand on the weak, affected side to provide support. Question 119. A resident is grieving over the recent death of her husband. How can the nurse aide best offer support to the resident? A. Leave the resident alone as much as possible. B. Encourage the resident to express her feelings. C. Change the subject when the resident speaks about her husband. D. Tell the resident about the nurse aide's own experiences with death. The correct answer is encourage the resident to express her feelings. Allowing expression of grief is supportive. Question 120. A nurse aide is assigned to care for a resident who has wandered over to another unit. What is the nurse aide's most helpful response when bringing the resident back? A. Let me walk with you. B. How did you get over here? C. Don't you know where you belong? D. Don't you realize I have a lot to do? The correct answer is let me walk with you. Gentle redirection without scolding is appropriate for wandering. Question 121. A resident has a cold and is using tissues for his nose. There are used tissues on the resident's bed, floor, and bedside stand. What should the nurse aide do to control the spread of infection? A. Report the resident's behavior to the resident council. B. Task the resident to throw his used tissues in the toilet. C. Pick up the used tissues in the resident's room once a day. D. Attach a paper bag to the resident's bed and ask him to put the used tissues in it. The correct answer is attach a paper bag to the resident's bed and ask him to put the used tissues in it. Providing a convenient disposal method encourages better hygiene. Question 122. A resident tells a nurse aide he is going to kill himself. What should the nurse aide do? A. Nothing, because people who threaten suicide usually do not kill themselves. B. Call the resident's family and ask them to come and sit with him. C. Tell the resident that things are not as bad as they seem. D. Stay with the resident and call for help. The correct answer is stay with the resident and call for help. Take all threats seriously, ensure safety by staying and getting help. Question 123. A nurse aide sees the charge nurse swallow medication that belongs to a resident. What should the nurse aide do? A. Ignore the incident because the charge nurse might get the nurse aide fired. B. Tell the resident's family that the charge nurse is stealing medication. C. Report the incident to the administrator or nursing supervisor. D. Suggest the nurse get help immediately. The correct answer is report the incident to the administrator or nursing supervisor. This is a legal/ethical violation that must be reported up the chain of command.